Hey everyone, thanks for attending the webinar today. We are going to get started here in just 1 minute. We're going to give just a minute to allow some people to continue trickling on in, and then we'll go ahead and get started. All right, everyone, we're going to go ahead and kick this thing off. Thank you all for taking some time to join us today for the webinar series. We had a great time last week, and we're excited to have another good time today in these sessions that we have planned for you. So just to kick things off, you've got your favorite duo, Lori Boyer and myself, and we are excited to be here. We have a lot of good content that we are going to want, we are going to share with you today that we've compiled and put together for some different ways that are going to help you continue to morph and change and adapt your practice in these different times right now. Before we jump into that, just a few housekeeping items. We would love to have you connect with us on Facebook, Twitter, or LinkedIn. If you do have questions, please don't hesitate to drop those in to the GoToWebinar box in that little pop-out window. And please don't wait until the very last minute of the webinar to drop your questions in. We love having the questions come in as we're working through the slides, and we're often able to answer questions as we go. But even if we happen to pass something that you wanted to ask a question about, don't hesitate, ask that question because there's a good chance we can work that into what we are going to be presenting on an upcoming slide. If you do have any support related questions, we recommend going to community.solutionreach.com and clicking on the My Support link at the top of that page to get in contact with our support team. One other thing here, we had a few individuals who had a little bit of a difficult time last week with the audio. If you are having problems with the audio, we recommend using the call-in method to the webinar today. That usually resolves the audio problems. I know some of you have computers out there where, heck, even I'm not sure where the settings are for the audio sometimes. So that can be a bit of a drag, but if you call in, that should solve any of the audio problems that you might have. Okay, so the agenda for today, we're going to be talking about the driving forces behind touchless technology in the practice. We're going to be talking about two-way texting, digital intake methods, online scheduling, and contactless payment options. And with that, we are going to turn it right over to Lori Boyer.
Hi, everybody. I just have to say I want to start by talking about the word touchless. Doesn't it seem like that's just one of those words that is suddenly new in our vernacular, that we have all of these new words that have been created and that we're hearing all the time due to this pandemic, and touchless technology is kind of one of those. So I'm excited to talk about that today. Specifically, keeping yourself and keeping your patients safe, keeping your practice running, what you need to do for the touchless technology. So one of the things that we've seen with COVID-19 and this whole pandemic is that technology that allows you to reduce touching has shifted from being a nicety to being a necessity in our world. And there's a variety of reasons this is happening, and it was actually happening even prior to COVID-19. This situation just kind of accelerated our need to do so. So there's a couple of reasons why that especially I want to touch on today. First, having the ability to not need to touch as much obviously reduces the spread of germs in the office to keep you safe as well as keeping your patients safe. But it also helps facilitate your ability to conduct, distance appointments away from the office, telehealth, telemedicine. If your patients obviously are not right in front of you, then you need to have a way to be able to complete your processes without them being there. So let's go on. Yep. So let's talk about being in the office for a minute. One of the big drivers in healthcare with touchless technology has been germs. Obviously, I think we all know any environment where you're going to get a lot of people in and out, constantly shifting, you're going to increase your risk of germ spread. But in healthcare settings, that's even more so, especially if you may be seeing patients who are sick. There have been a few different studies on this topic. A University of Michigan study found that 1 in 3 objects that you have in your office that may be commonly touched will have some sort of bacteria, germs, things that might make you sick. Studies have shown that kids have a higher probability of getting sick in the 2 weeks after they go in for a well child visit because of the germs they're touching in the office. 70,000 people die each year from infections that they didn't have, but they picked up while they were at the hospital. And of course, in terms of COVID-19, healthcare workers, we all know, and this is a big concern to me and to all of you, I'm sure you're 12 times more likely to contract COVID-19 just due to all of this germ spread. So obviously, we're needing to step back and find a way to reduce some of that spread in your offices. But in addition, we're also need this touchless technology because of telemedicine, telehealth. We have been way into this shift into, meeting with our patients at a distance, since we're not always able to meet with them in person as easily. And we're going to have a full webinar next week all on telehealth. And so I'm not going to get into a huge, really detailed account of that today because of the fact that we've got a full webinar on it tomorrow. It's a huge topic. So one thing I did want to address, though, in terms of telehealth, I've received a few questions on, if it's going to stick around, what is going to happen with regulations and those kind of things. And so I have been doing quite a bit of studying into projections and what experts are saying in terms of the probability of telehealth in the future. And I just did want to share with you today some of the policy changes that experts think will stay, as well as some that are probably not going to stay. The great news is payment parity is looking like, according to at least the expert forecasts, that it will stick around. We should be able to still have the new types of telehealth services, eligible providers, those kinds of things, the telephone visits, and home as an eligible originating site. These are things that experts are saying they think that the policies are going to stay as they are. Unlikely to continue are kind of some of those flexibilities, our out-of-state licensing flexibilities, and the HIPAA exemptions. So we've had loosening of what type of things you're able to use for these visits. So we could use Skype or FaceTime, things like that right now. Those exemptions are likely to go away as well. So that's just kind of a little teaser, I guess, for next week on what you can know, but just know that telehealth is here to stay, and it's going to become what we call hybrid care, where you are combining having visits at your facility as well as away from your facility. But doing this is going to require a lot of these new technologies and processes. So that's the touchless technology. So we think about touchless in terms of, just protecting from germs, but it's also really means that you don't have to have somebody right there in person in order to, finish that procedure. So a few of the things that you're going to need to have as you're implementing hybrid care is two-way texting, a digital intake process. Obviously, you have to have telehealth technology and remote payment options. Those are kind of the very basics, and we're going to go over some of these today. But of course, there's a lot of other things that can make the process even smoother. We're talking surveys or automated reminders, things like that are also important, but these are absolutely critical in developing a hybrid care solution. So I guess we'll just dive right in then to our first touchless technology, two-way texting, and kind of give you a little bit of the why on why two-way texting is a big deal. And then I'm going to have Addison go ahead and talk to you kind of about the how and what and the nitty gritty of best practices and digging into it and knowing what exactly to do. Two-way texting is super important right now. Of course, there's some background stuff. We know texting is the most popular way to communicate. And so it's just the easiest and fastest way to be able to talk with a patient at a distance. I mean, that's really what it comes down to. There's a few different ways that you use two-way texting to, keep up the sanitation levels in your office and as well as telehealth stuff. So one thing that we're seeing a lot of practices do is they're adjusting their waiting room and they use two-way texting for this. So if you have a small waiting room or you're not able to appropriately social distance within your waiting room, offices are having patients wait in their car and then they text back and forth to let them know when they're ready. So that's an easy way to use two-way texting to, improve the safety and sanitation of your office. But it's also a really, really good way when you're doing telehealth. This is something I always recommend, that your patients know, like, hey, you can text me if you're having an issue. I personally have had a few telehealth visits. I had my first, I think I've mentioned that before, my first telehealth visit took place during this pandemic. And so that's been fun for me. But on one of my calls, I did have a little bit of a glitch. And so we were able to kind of text back and forth and say, hey, this link's not working. And they texted me and said, oh, whoops, I got the wrong thing. And so it just made the process really smooth. So having that ability to be able to just fix any problems when you're doing telehealth visits, two-way texting is kind of your way to go with that.
This is where I get to jump in.
You jump in, Addison. Tell us the best way to do it.
So, you already kind of touched on some of these things, Lori, some of the different best practices that we are seeing our customers begin to implement. But when you are, looking for a two-way texting tool, there are a few things that you want to look for, right? It should make use of your current office number. You shouldn't have to, get a new phone line or anything like that, because that creates other headaches, right? It has a bit of a cascading effect. If you have a new line that can only be texted to, do you have to update your marketing messaging? How do you communicate that best to your patients, and so on? So if it makes use of your current line, that's ideal.
I was going to say, I think the key with that is just, everything that's as simple as possible for our patients, right? Like, I don't know, we're not always the smartest patients out there, so we get confused about what number to text and who we call, and all of that's tricky.
No, you're absolutely right, though. And that's the thing is from the healthcare side, when we're there in the practice, right? We're there day in and day out treating patients. We have a little bit of extra insight that our patients may not. And so things that we may think are oh, this is obvious, that, it's obvious that they would need to do this to contact us. They may not really be all that obvious to patients who don't have the same insight that we do. We run into that sometimes here at Solution Reach, where we think, oh, this will be so obvious for some of our customers. Then we have to take a moment and step back and say, you know what? No, we need to help our customers understand, this thing or why this is important. So it's not unique to even healthcare. Lots of different industries experience things like that. But some other features that you want to look for in a two-way texting tool is a way to track the message history, right? That's extremely helpful. I've run into situations in the practice where, you have a little bit of that he said, she said with a patient, and it's, in my situations, in my experiences, it's always been in regards to a bill of some kind, and
Yes.
we've had to try and think, oh no, how do we have do we have a record of that statement that was sent, and so when you have a trackable message history, that helps reduce a lot of that. And it's not just a kind of a safeguard for your practice, but it's a safeguard for the patient as well, because they have that same message history right there in their messaging app on their phone. The two-way initiation thing is huge. Texting should be two-way. It shouldn't be, only like the provider shouldn't be the only one that can initiate that. The patient should be able to initiate the communication at their convenience, at their leisure. Again, just like you said, Lori, make it more convenient for the
Yeah.
patient.
And I
Um,
think that too, with the two-way initiation, one of my recommendations is always to make sure patients know. So if you do have that ability to two-way text with patients, sometimes patients get reminders or something, and this happens to me, and I think, I wonder if I can text back. And I work with texting in healthcare and stuff, but I'll get a reminder like, Lori, you've got an appointment tomorrow, and I think, oh, I need to change it. I wonder if I can text back or not. So just kind of creating an environment where you do share on your website or in social media, or when you talk to them, hey, you're always welcome to text us back or to text us first if you need, because patients often are uncertain again.
Yeah, you're right. There are still, generations of patients who are still getting used to this whole technology thing. Some of them are doing it with gusto, though. They are definitely, my mom is my favorite example of this. My mom is in her late 70s, and some days I have to put my phone on silent because she texts so frequently. She just loves it. She loves the communication. For her, I asked her about this one time because she used to be an office manager as well. She said, I would have loved something like this in the practice because it was such a headache to, pick up the phone and have to try and contact a patient. If you didn't get them, you got their voicemail, and then you had to wait and see if they called you back. So, she loves it. As a patient now, she loves being able to text back and forth with her practices, and it's just a huge convenience for her.
I love it
Another,
too. There's so many times when I've texted back to change an appointment or something where maybe I wouldn't have, that if I had to
yeah.
call. So, okay, we're
We just,
going
we
off.
just got a
Sorry,
we
guys.
just got a great question from Mark. He said, "How do you
Okay.
cover after hours messaging, especially if there's a concern or of an urgent or an emergent situation?" So that's a great question because in our texting tool, SR Conversations, you have after hours messaging and scheduling that you can set up. So if a patient contacts you after hours, you can have a pre-populated message that says, kind of the typical, hey, if this is an emergency, go to emergency services or call 911. But if you need us, we'll see this message tomorrow and we'll respond to you at our earliest convenience. So that is addressed. We have an option, that's a part of this tool that we provide in SR Conversations. That's a great question, and it is something
Yeah,
you should
you
look
don't
for.
have to be texting 24 hours a day, so don't feel
Oh,
worried
I,
that if
you know,
you're going to stop texting that
a
it's
quick
always on.
story on that. I used to live that life when I was an office manager. We didn't have a tool like Solution Reach, and what we did at the end of the day was we forwarded our office phone to my phone, and so I got
Great.
calls on date night or movie night or family night, and it was a headache, and we'd even get them, in the middle of the night because patients have emergencies, and if it's related to the care that they just received that day in the practice, they try to call you up, and you have to, hey, you probably want to go to an ER or whatever it may be, right? So having this option is extremely important, and that's why we built that right into this tool. Another thing too is having the option and the ability to flag messages. If there are messages that are higher priority than others, because sometimes that happens. You need that option. Uh, One of the biggest things is you need a method to gain HIPAA compliance. Now, two-way texting, it's still texting, right? Texting is not HIPAA compliant, but in our tool, and in many out there, there is an option to gain consent from the patient to explain,
Hmm.
hey, texting isn't secure, but if you consent, if you're okay with us, corresponding through this method, we'll take that as your consent. And again,
Yeah.
that's the ability to ask that permission from patients right from within the tool is extremely important.
Yeah, it becomes written consent within the tool, and it can be saved so that you have it flagged and you can know that this is, a HIPAA compliant conversation. And of course, you have to let the patient know, like, hey, if you're not comfortable, I think within Solution Reach, Addison's our expert on the platform, but within Solution Reach, the message is written out for you, so you already know, you know, it has all the legalese stuff you have to say. But one of the things you do need to do if you're not using Solution Reach or something is you have to make sure that you offer to speak to them in a different way, in a secure method, if they're more comfortable with that. So you could then hop into, you know, an actual in-person visit or through some sort of other secure channel if you need.
Yeah, and that kind of falls into the automation side where, you know, you're going to get frequently asked questions, right? I mean, one of the most common ones that we got all the time was, "What are your hours?" You know, or "Hey, what's your address?" You know, all those different things. So there are some templates that, you know, or some method of automating the response to those types of questions, or even just having templates available so that you don't have to type out the response every single time. You can just go select a response and send it off. That saves you time, right? So this is what, you know, this is what we have as SR conversations. This is our tool to help address the two-way texting question. Oh, we just got another question here. It looks like Suzanne, I'm hoping I'm pronouncing that correctly. Suzanne asked, what do you consider a live interaction with a patient? Is it in person, audio, video, texting? That's a great question. Lori, do you want to tackle that one?
Yeah, so um, if you are, when you're talking about a live interaction, um, you would be, that would include obviously in person. If you're talking with someone on the phone, that's a live interaction. Texting is a little bit, you know, you may have a little bit of a delay depending on if you got a text and you were talking to a patient and then you hop down and respond to it. Um, so I guess in what context you can follow up, Suzanne, if that's how you pronounce your name. My mom's name is Suzanne. That's cute. Um, but and follow up with, you know, in what context are you asking the question? What do you are you referring to it in terms of compliance, in terms of payments, you know, reimbursement, things like that? Just let me know and I can give you a little more details on that.
We got another one in here from Janet. She says, what is the app for Android? So great call out, Janet. For a long time, we've only had the app available for iPhone, but an Android version of the app is coming very, very soon. And in fact, this is what this screenshot is. This is what it's going to look like on Android. And that
Shout
will
out
be
to
coming out
Android
very soon.
users. I'm an Android user, so
Yep,
forget
that's
these
right.
iPhone people like you, Addison, right?
We can all coexist, right? That's good.
Yeah,
Good to
that's
have
right.
variety. Uh, with conversations, again, if you have a tool that you can use for two-way texting, you need to encourage the use of texting to your patients, right? You need to make them aware that, like Lori mentioned earlier, make them aware that they can text, and then continue to encourage that, right? By, you know, notifying them, you know, in social media, changing things on your website, you know, emailing them. We've seen customers change their voicemail message to say, "Hey, thanks for calling us. We're busy right now and can't take your call, but did you know you can text us?" You could even be the one to initiate the conversation if you want, if that'll kind of kickstart the communication method with your patients. You can be the one to initiate the text. So again, like last week, we have links in this deck. We will be sending out a PDF of this deck. All these links will be clickable. So we have a few of those for you that show how to gain HIPAA consent in SR conversations, how to use that templated messaging, along with a whole guide on best practices for use of SR conversations. But again, the main thing here is, you know, you want to always respond to those texts that are coming in from your patients. You don't want to just leave it on, you know, unread. Uh, and another thing too is that, you know, many of us are very comfortable conversing on the phone with our patients. We understand what a professional communication sounds like on the phone. And be careful when you are carrying that professionalism over to the texting realm, because, you know, text is hard because you can't hear the intonation, you can't hear the tone, you can't hear the inflection of the other person. So be very considerate of how your message may come across. Some of our customers have commented that, oh yeah, when we first were getting used to texting our patients, we'd write something and then I'd have, you know, one of the other gals in the front office look over it and read and correct me and, oh, that sounds kind of mean, let's phrase it this way instead. And, you know, so there's just other considerations to
Yeah.
take into account here.
I've done a whole video on this at some point. Uh, anyway, you can always hop into our YouTube channel or something and you can see those. But I always recommend with texting, You tend to sound a little bit formal and stiff, which can be read as mean, especially if you're following up like you missed an appointment or something. And people might get a little bit sensitive about it. And so, um, obviously, don't go off with like, TTYL, bro. You're not wanting to be unprofessional in any way, but do sound natural. And I always recommend it doesn't hurt to include a smiley face or something like that that will then be like, here's my thought and here's my emotion. Like, I'm happy, oh, we missed you in the office. Let's set up a new appointment, smiley face, right? That doesn't come off as
Yeah.
mean, where the other one was, you missed your appointment, please reschedule. Maybe they feel like they're in trouble.
Laura, you said that in only the way that a mom can say that. I felt like I was in trouble as soon as you gave that example. So,
Exactly. Uh-huh.
oh man. So with that on two-way texting, let's move on to the intake process.
Okay, intake. This has been one that I think has been a huge shift for us with COVID-19. A lot of us weren't really familiar with doing this whole online intake process. I just say one of my doctors has been doing this for some time, not with Solution Reach, but through another service, and I love, 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 love it. And I also had to say that every time I fill out that intake process, there's a spot there for me to pay, and I just always pay without even thinking about, not that I'm trying to not pay, but it's an easy way to do stuff. So digital intake is huge right now. No more gross clipboards, no more gross pens. I was reading a study just this week that said clipboards and pens are some of the most sort of contaminated objects. So I really hope right now you guys are not using clipboards and pens. If you are, make sure you are sanitizing like mad, because there are a lot of germs spread through that. But beyond just the whole obvious, it's not as gross, there are a lot of benefits to the digital intake process. It saves you time, it cuts costs, it improves accuracy levels. One of the stats here, 61% of claim denials actually come from typos, and those usually happen when we're just busy and typing really fast in the information that was written down on the clipboard. In terms of cost savings, 3% of your entire revenue goes just to paper. I mean, 3% seems like a small number, but when you actually add up the thousands of dollars that is, it's pretty crazy. And it also protects patient privacy more. You don't have papers floating around, and it improves your patient experience overall. What's interesting is that I think people get tired of me always saying, I was reading a study, because that's how I sound in like my daily life. It's a hazard of my job, I guess. But 51% of people, the majority of people, actually preferred digital intake before this pandemic even hit. And I just have to share, and maybe I'm going to step on Addison's toes here with something he's going to say, but I've shared before that I have 7 children. Yes, 7. And I have had some nightmare experiences filling out paperwork at doctors and dentists and optometrists. And so for me, when I'd schedule visits, especially for like the dentist or the eye doctor, things like that, I would often have 4, 5, 6, 7 kids with me. And I would be handed 7 clipboards. And so I'm like feverishly trying to fill out all the papers while I'm also trying to manage my children who, maybe they're nervous. And so I've got a 2-year-old crawling up my head, and I've got a 5-year-old over there who's thinking maybe they're going to try out getting into something that nobody wants them to touch, or, and it is honestly a nightmare. And when I started having a doctor who let me fill out all of that info before I went, pediatricians, if you are on this call, please get a digital intake process, because it literally changed my life as a mother. So that's just my own little soapbox story. Addison, take it back.
As a father of 2, I can agree. I know that kind of craziness that can ensue when you're trying to fill out multiple patients worth of information there in the practice. So, And that's, you called it a great point too, Lori. With digital intake, it doesn't have to mean that you wait for the patients to get into the practice and then you hand them an iPad or whatever, right? In fact, the better situation would be to have an intake process that allows you to send the intake forms to the patient long before they even arrive at the practice. And as a, in the situation we're in right now, right, in the current pandemic, this can be used as a helpful screening tool as well. We talked a little bit about this last week, where you may use pre-visit instructions to remind your patients, hey, if you are experiencing any COVID-19 symptoms, please call before showing up. You can do some of that same asking, the same type of questioning in the intake process, right? So with some of these different things, you need to have an option to customize the forms you're going to be sending to your patients. You also need an option to collect the needed information, right? Whether it's demographic information, insurance information, health history, right? You need those options. It has to be a full replacement for the stack of paper that goes out on every clipboard that some of you may have. But another thing here is that the intake process is going to help you decrease the no-show rate, because it helps prepare your patients who have confirmed their appointments. We talk a lot about our reminder strategy of sending the appointment reminders out to patients 3 weeks, 3 days, and 3 hours prior to the appointment. If you're sending these intake forms to those confirmed patients 3 days in advance, they can, if they fill those out, they can arrive for their appointment. And if all's going smoothly in the practice, let's hope it is, right? Let's hope you're not backed up. But as they arrive for their appointment, they don't even need to sit down in the waiting room, ideally, right? They walk in, they have filled out all the paperwork, you take them right back to the treatment room and you get going. And that is a fantastic experience to have as a patient. It's happened to me very few times, but when it does,
that would be my
it's
dream
magic.
experience.
Yes. It is magic when it does happen. And as
One
far as
cool
increasing,
thing. Oh, can I say real quick, Addison? One
yeah,
cool thing about having people fill out their intake forms in advance is that for whatever reason, psychologically, if we've done something like we've made an action, this is applies to actually every area of our life, but it makes us much more likely to then follow through. So if somebody's filled out their intake form, they are much more likely to then show up for their visit. That kind of goes back to the decreasing no-shows. There's just something in our psyche that kind of plays into that. So that's just something I wanted to add.
right. You're kind of more bought in, right? Like, well, I already filled out all the stuff, I better show up, right?
Yeah, exactly.
Lori, we had a question come in from Dean. Dean asks, how has the adoption of digital intake been for older adults? Is there anything that you'd like to talk to about that?
Yeah, this is one that I've had people be really worried about in telehealth, as well as intake, as well as all technology. And I think it kind of goes back to like talking about your mom and stuff, Addison, but our older adults are actually becoming super adopters in some ways. And it goes against a lot of what I think would be natural. Sometimes, and I want to make this a caveat up front, there may be a few little bumps at the beginning, but once you get them through that initial time, so the first time of getting them to fill out their online intake or their first time of getting a telehealth visit, they buy in fast and they're adaptable and they love the convenience of it. So set up, I would say, if you have a lot of senior citizens in your practice, if you have a lot of people over 65, if that's a demographic you're struggling with, maybe find a way to help walk them through it a little bit more closely the first time, because it'll pay off big down the road. They'll be totally fine doing it later. I had an office even tell me, they suggested having grandchildren help the first time, or talking to a neighbor, or getting some sort of support system. And then once the first time was done, though, they've been great at being able to handle it.
We just had, so Barbara jumped in our chat and she said, I have Solution Reach and I love it. I use the reviews, the confirming, the older patients love it. So,
Yep.
that's at least one person who has older patients who enjoy this experience. So thanks,
Yeah, I
Barbara,
think it
for jumping in.
surprises us. It surprises us sometimes. We just automatically think, oh, older patients don't want this technology, but honestly, they do. And as from this point on, people are only going to want it more. So if you're looking at it now, in 10 years, obviously, the people who are 65 were 55. And, you see my amazing math skills there. But my point is that down the road, this is just going to increase. This isn't something going away. This is something that's going to become even more prolific in the industry. So, it's a great idea to get people used to it now.
Yeah, you're absolutely right. And it's gonna, as it decreases the no-shows, it's also going to increase, your revenue by allowing you to make, those visits shorter, right? We've had a few people that have reached out to us and say, hey, with different methods I've been using to improve my processes right now, we're actually able to see more patients than we were before.
Yeah,
So
that's
that's another
the
thing to take
really
into
great part.
consideration.
Efficiency, efficiency.
Yes. We had another question come in from Sandra. She says, our practice has a form patients need to fill out on every visit. That form then needs to be scanned or uploaded to their chart. How will that work? Fantastic question, Sandra, because since this is all a digital process, when a patient completes their intake paperwork, what you can do is you can actually download it right from the Solution Reach platform and then upload it right into your practice management software. So you don't need to scan papers or anything like that. And again, with SR intake, you have full control over, the questions that are being asked of patients, the forms they're filling out. It's a fully customizable situation for you. So I'm very confident that it would be able to adapt to whatever forms you may have in your practice. And again, we've added some different links here that will be clickable when we send out the PDF copy of this slide deck
Can I
later
ask a
today.
question, Addison?
Of
Here's me.
course.
Addison's like our platform expert to me, so I always ask him all our questions. If you have a form, do you know? I'm putting Addison on the spot. If you have a form that they do fill out every time, does it have a way to pre-populate or anything, or is that something that they fill out each time?
So there are some options to pre-populate information, but it's more along the lines of the demographic information, like their address,
Yeah.
their name, things that are not going to change. Typically, the forms or a questionnaire of some kind, those you don't necessarily want to pre-populate because something may have changed since the last visit.
Right.
So in
Yes.
that case, that's where they will typically leave it open and not assume, because sometimes in the past what we've seen in other systems is that we have that aren't related to intake. If we pre-populate information, sometimes patients miss that, and the incorrect information gets used. The doctor looks at the chart and says, "Oh, it looks like you haven't had any surgeries the past 6 months," and the patient's like, "Oh, I actually missed that question. Yeah, I had a surgery like 2 weeks ago." So
Yeah, I have to say, as
it's
a
kind of
patient, yeah, as a patient, so I told you I have this one doctor who uses a digital intake process. It's not Solution Reach, but I still really enjoy it. And that is one thing I love, 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 though, is it always pre-populates all that boring information. And again, if I have 5 things I'm filling out, I hate writing my address 5 times, and I hate writing the birth date and those things that don't change. I mean, that's just a huge time saver for the patient. And again, it helps reduce some of the typo issues of needing to retype things in or scan things in or whatever we're doing. So yeah, but really great point that we don't want to pre-populate things like, oh, have you been in an injury? Have you had an injury or something recently? So
yeah. We had one last question come in from Stephen that we'll answer before we move on to the next thing here. But he asks, can this be used for internal office communication? Does it have the capability for giving a due date? So currently that functionality doesn't exist for intake. We haven't had any of those requests from our customers yet for that type of functionality. That being said, there is definitely a method we would love you to use if you are a customer and you'd like to provide some more feedback. The feedback goes directly to our product team who develops products like SR Intake and continues to make them better. So even if a functionality doesn't exist yet, and again, you can go to our community, it's community.solutionreach.com, and you can type in the search bar feedback, and that provides an article that shows you how to give your feedback. And again, it goes directly to that team who can then use it to make the products better. So great question. Let's move right along to remote payments, Lori.
okay, so payment, not touching keypads or all of those kinds of things are really becoming big right now. I read a study that talked about how 87% say that they prefer to pay in a touchless method. Now, obviously, it makes sense. I mean, if you're going to have a lot of people coming in and out, um, obviously the payment, everybody's going to be paying, and that is going to have a lot of germs. It's kind of like a door handle or something. Everybody touches it. So most people really, really don't want to have to. There are a few different ways, though, that you can do remote payment, touchless payment. You can keep a credit card on file. This has been shown to cut collection costs eventually by like 34%. So you then just charge people, you set up a plan. Again, this sort of the second one here is to set up a payment plan you can do and then keep the credit card on file. Now, I know that Addison has had some issues with this, though. Addison, why don't you tell us a little bit about that?
So, yeah, this is one of those moments where I tried to be measured because I can tend to get very excited about this topic. It's one I'm passionate about. So at the practice where I used to work, before I stepped up as the office manager, uh, we did have office staff that were keeping credit card information on file. And that's a common thing, right? But there's a right way and a wrong way to do that, because the way that we were doing it uh, prior to me stepping into that role is we were not doing so in a very secure manner. Our practice management software was locked down with passwords that were unique to each of the employees. But if someone really wanted to, a member of the staff, for example, if they, were feeling malicious, or if they were, going to be leading the practice on bad terms or things like that, they could, it could have been detrimental to our patients' financial health. So when you keep credit cards on file, make sure that you are doing so in a secure method. That is extremely important.
Yes.
And it's something you may want to discuss potentially with your legal team to see, what are our liabilities here? What does this open us up to as potential hazards, right?
Yeah,
Because
it can be
if there's,
catastrophic if
in our
something
case,
happens.
oh, absolutely. And in our case, our decision was, you know what? We don't even want to go near that. We're not keeping any credit cards on file at all anymore. That was my decision when I stepped up to that role. I said, nope, delete all of it. We're not doing that anymore. So, and because we didn't have an option for remote payment, it was kind of a burden on us. We had to then, resort to the typical call up a patient, have them tell you their number over the phone, which, that has all of its other, all of its own
Yeah.
concerns, right?
And that's what
If
I
the
was going to
patient is
say.
at work or somewhere public, they don't want to give their number. So
Yeah. So those are an option for remote payment, is the payment over the phone or even verbally in the office if somebody isn't wanting to touch stuff. Um, the biggest issues with that, again, it's just kind of a really cumbersome process, and it's just kind of an efficiency killer, as well as the fact that it's not as fun. Not that it's ever fun to ask people for money, but it's not very enjoyable to call and be asking for money. I'm sure none of you guys like to do that. That's just the worst. So,
you feel like a like
um,
a like a creditor.
yeah, you do. You're like, when did my job turn into this? So, and because we don't like it, we tend to kind of avoid it, honestly. So, digital payment options tend to be the best option for remote payment. This may include in your patient portal, but also like by text messages or things like that. Addison, you tell us more about the best ways to do those kind of digital remote payments.
Yeah, kind of going back to that ideal situation of the intake process, right? Patients filling out their intake paperwork ahead of the appointment. You can do the same thing with sending a payment link. There's no reason that you couldn't ask patients to pay, for the proposed treatment that day ahead of time. What we would do at our practice, in fact, is we would tell our patients, hey, uh, as we're preparing to give them a treatment estimate, we'd say, this is an estimate from your insurance as to how much they may or may not pay for this treatment. Would you like to pay any of that today? And often patients said, yeah, I'd love to just take care of it today rather than put it off. And so we'd say, great. And again, this is just an estimate. This could fluctuate depending on what the insurance actually pays. And sometimes, we'd have the insurance claim come back and it would say, hey, the insurance paid more than we thought. So, Mr. Patient, we're going to credit that info or that money right back to your card. And in some cases, it was, hey, it looks like insurance, paid $10 less than what we were expecting. So we just need to collect that additional $10 from you today. And it was a very convenient process. But again, if you take care of that ahead of the appointment, that's one less thing that the patients have to do in the practice, right? This can help reduce the amount of time they are physically in the practice, right? They don't have to sit in the waiting room. They don't have to do their appointment and then come to the front desk and wait around while you process the payment. Again, this just helps the efficiency. It helps the flow of things. And again, you can continue to look at those patients who may have overdue balances and send those reminders out to them via text or even via email if you'd like. These are different options you can do to continue to collect payments from those patients who are overdue. We had a quick question. Stephen clarified his previous question about being able to use things internally. He clarified, he said, I actually meant texting between staff, not intake. And this kind of can play into this. So in SR Conversations, which is our two-way texting tool, this is where the remote payment option for us lives. This is where SR Pay lives. And in SR Conversations, there is an internal tool called SR Huddle. You can search for that on our community. There's many articles that I've written on that. But this is a great way to use that internal tool, because you can front desk staff can be talking to staff in one of the treatment rooms and say, hey, looks like the doctor's going to be a moment before he is able to make it into that room. Nancy, she owes us, $20 for a previous appointment. Would you go ahead and remind her of that? I'll send her a payment request right now while she waits for the doctor. She can pay that while she waits. So yes, that there are ways to communicate between staff internally through SR Conversations, and this would be a great opportunity to make use of that.
Yep.
Another question here from Dean in regards to payments. Dean asks, do you anticipate copay waivers for telehealth being rolled back? If so, how can payment be managed prior to initiating the visit? Dean, that's a great question. In regards to anticipating it, Lori, did you have something you wanted to say?
Yeah, I was just going to say one of my I always say one of my doctors. I have like some autoimmune diseases, so I see a few specialists. But one of my doctors does require for our telehealth visit a copayment now even. And they simply send me a text link that says, hey, we need to receive this payment before our meeting. And I just send out the payment. So even if there's not if that waiver's gone, it's still easy to do by text. I have another office that I worked with who during their telehealth kind of visits, they do the intake and then they simply send the link right immediately following. And as people are already engaged in doing things, people just have a tendency to click on it and just pay. So yeah, but again, payment stuff, from my understanding, we're still waiting to see exactly what's going to happen. All I've seen for sure is, payment parity. They're thinking it's going to stay around. I'm not totally sure about the waivers. Have you heard anything, Addison?
I haven't heard any updates as of right now. But we kind of know how it is. The updates seem to be changing on a somewhat daily basis. Sometimes it feels like it's an hourly basis.
Yeah, we'll
So
keep you updated.
Right?
We'll always make sure we're staying on top of that as that happens.
Yeah, absolutely. We had a question come in from Barbara. She says, we use Phreesia in addition to Solution Reach. How can I send the patient a link to pay their payment through Solution Reach? Is it automated, or can I pick and choose who gets the text message? That's a great question for this particular screen, Barbara. Again, these links, check them out in our community, because it shows you how to send these payment requests. This is what it looks like right here on screen. If I was going to send a payment request to Julie Williams, we would send this request and put in the amount. If there were multiple patients, let's say Julie has a husband and 2 kids, they would also show up in this list. So we could select, hey, the payment is in regards to a balance for Julie's daughter. And so we could check that box next to Julie's daughter and say what the amount is and send that right off to Julie. So this is a manual process. You manually send these payment requests to patients, so that they can pay when needed. So great question, fantastic question. Let's move on.
You're saying,
to
Addison, that she could include a link for her other systems or however. I just wanted to make sure I was catching that completely.
So good question. So using this method, if you're sending a payment request, all you simply do is put in the amount and you send it off. But of course, if it's two-way text, you can you can create and craft messages. So if you are using a different system to collect payment that patients can use online, for example, you should be able to just put a URL, the website that they need to go to, right in the text box and send it as if it's just a regular text. So that
Yeah, it's
option
the
is
same.
available as well.
That's the same if you're using a different telehealth service or anything like that. You can include links to other things within the two-way texting program. It's not a problem.
Yeah, absolutely. Let's move
Okay, so
to online scheduling, Lori.
online scheduling. So this one is a lot more of the like, let's streamline everything. Let's make the processes smooth and fast and easy. I also have an office I talk to where their patients need to be seen on a regular basis because of just the type of specialty they are. And so they always just shoot off a link during the intake process to reschedule again. So that's another cool way to do it. But online scheduling, there's huge benefits to it because it's 4 to 8 minutes typically on average to book an appointment by phone. That's what research shows. But it only takes 30 seconds for patients online. And obviously for you, you're not even on the phone. So it saves your patients time. It saves you time. A really cool thing about online scheduling is that it really fills all those darn annoying gaps in your schedule. The majority of appointments that are scheduled online are for the same day or for the next day. Those are often, hard appointments to fill because, it's just not very far in advance. But basically, online scheduling is a great way to create loyalty, and reduce churn in your patients while making life just a lot easier and more efficient for you.
You're absolutely right. It's helping that loyalty continue to increase is crucial, right?
Yeah, and it's just, again, it's super important in a way to stay competitive today. I think one of the most interesting stats that I've seen is that 94% of patients, if they're looking for a new practice, they would pick one that offered online scheduling. But even more than that, 31% of people, that's almost 1 in 3, say they would leave their current doctor and find a new one if that other person offered online scheduling. I think we're all becoming a little antisocial these days too. No, Addison, we're just busy, right? We're busy. We're not antisocial, but
That's right.
we all
That's right.
prefer to, shoot off a text message or schedule something online and just not talk to people. We don't want frustrated, irritated patients, which is really what happens. And finally, people prefer for online scheduling, the number one most desired online scheduling service appointment is doctor appointments. They would much rather be able to schedule their doctor appointments. I'm not sure why, rather their car repair or something, but people really want you guys to be offering online scheduling. So this is just something, if you're going to stay competitive in today's landscape, this is something that's just going to have to happen.
Yep, you're absolutely right. It's just the convenience factor is becoming huge. I always liken this to, going to fill your car up with gas. It's been a long number of years since I've had to actually, park my car, go in and pay the attendant, right? I love being able to pay at the pump, fill my car up and just go, right?
And
So having
I've had kids so
similar
many
experience in
times.
healthcare is
Yeah, I was
great.
gonna say I've had kids so many times as a mom say it's 7 o'clock at night and they're like, "Mom, I really need to get new glasses," and I'll be like, "Oh crap, I forgot to schedule an appointment. Remind me tomorrow during work hours." And then I forget for like 2 weeks. So that's part of it, is just being able to hop on right then and schedule it.
Yeah, yeah. And again, some of these ideal features you may want to look for in an online scheduling tool are ways for the patient to identify if they are a new patient or if they are existing. What does that experience look like depending on what they select? In our situation with SR Schedule, patients don't just get to drop their appointments right into your appointment book. That's not how it works. What happens is they send an appointment request that you can then, you can confirm and say, yeah, this works for our practice and for our doctor. Or if maybe that spot got filled, you can say, hey, Mr. Patient, sorry, we're gonna have to deny that request, but we do have openings at this time, and this time. Do either, any of those work for you? So having that ability as well is incredibly important, just to give you flexibility and continue the control you have over your appointment book. But it should include things like fields for contact info and insurance, right? Similar to some of the things you might see in the intake process, right? You need some insurance information, you need some contact information. You should be able to, adjust the appointments that are available based on lengths of appointments that you provide at your practice. And, you know, again, back to the insurance thing, what we found extremely convenient are patients having the ability to send a picture of their insurance card. And they don't necessarily have to do that through a scheduling tool, right? You can do that through a two-way texting tool. You can send photos through SR conversations. And we've seen patients do that. They prefer to do that rather than type out their insurance claim number and all those different things. So again, it's just convenience. That's what it really is all about. So this is what our tool looks like from a mobile experience. If patients are coming in, they can identify if they're a new patient or they're returning. They can select the day, the time, you know, which provider they'd like to see. But again, that's up to you. You get to decide if they're able to select which provider, if they're able to select the appointment type that they're being seen for. So the control still lies with you. We don't just hand over the keys to the patients and tell them, start driving. So, and again, so some quick links in here that you'll be able to click in the PDF version of this deck that shows you a training video on SR Schedule, kind of an introduction to it, as well as some best practices. Now, one of the things that we've talked about in the previous week's webinar, and it actually has a little bit to do with a previous question. One of our attendees today asked, you know, hey, what's the pricing for some of these things? And you know, that largely depends on what products or features you already have. So we recommend, if you have those types of questions, we recommend talking with our sales team so that they can provide a more tailored response to your question. But SR Hybrid Care is a brand new offering that we have where it bundles everything together. It bundles intake, SR Telehealth, and SR Pay all together. And this is at you know, a different price than might be offered for these things individually. So again, this is a big question that we've been getting from different customers is, you know, talking about price. Well, it depends. And we want to give you the best response possible. So with that, I want to kick out a poll, actually two polls real quick. One is going to ask if you are interested in learning more about SR Hybrid Care. So we'll leave that up for just a moment while we allow you to fill that out. But you know, I just want to circle back to something that you said, Lori, something that you said multiple times, honestly, on a lot of these different slides. I need to slow down. The convenience factor for patients, right? When you have these different solutions, especially as we move into this hybrid process of kind of mixing in-practice appointments and appointments that are happening via telehealth, we need solutions to do all of the same things that we do in the practice via a digital and distant means, right? If you have telehealth appointments that are available, but you don't have a digital way for patients to check in, that's going to be a problem. It's going to pose problems. How are you going to remedy that? So a lot of these different things, they're kind of interconnected decisions that have to happen. So just one of those things that I'm very passionate about that. We'll go ahead and close that poll. I want to kick out one more poll. For those of you that mentioned, hey, I'm not really interested right now in looking at SR Hybrid Care, we would just love to know what's your reason. And we hope that we have a sufficient option there for whatever your reasons may be. If it's a specific reason that maybe we can address, or something that we can do to improve the functionality of our offering,
Yeah,
and improve the
can I
functionality of our
just
features and
say,
products.
if you're selecting other, or you have other thoughts, please like throw them into the question area even right now. As you know, we've talked about before, my job is really all about research and about understanding trends and trying to help develop plans. In fact, I'm in the middle of setting up a complete hybrid care process, sheet for you guys, workflow, so that you can know, whether you're using Solution Reach or not, the best ways to manage kind of hybrid care. But I would really love to know what challenges you're seeing, why you're not, what are the reasons behind not using it, or you are using it, or if you're saying, I love it, but except for I have a problem with X. Please share that with me so that I can do research and I can understand, we're all in this together, working to understand and get ahead of this shift that we're seeing in the industry right now. So anything you can share, any information, let's work together so that we can make this awesome and easy for you guys.
Yeah, absolutely. And that pretty much wraps us up for today, but I do want to let you know we do have upcoming sessions next week and the week after. And like Lori mentioned, next week is the big telehealth week. That's when we'll be diving in really deep into telehealth and telemedicine. And then the week after that, we will be covering social media marketing tips to continue to help you bounce back,
Yeah,
from all of this.
we're bringing in a social media expert that's all they do to tell you what to share, what to say, what are the best things to do right now during COVID-19. So obviously social media is not what we do here at Solution Reach, but we know it's really important to your practices. So we want to make sure you've got all those resources.
Absolutely. All right, well, everyone, thank you so much for attending today. We really appreciate all of the questions. We love getting the questions, we really do, and thank you for asking them. If you do have even more questions, please don't hesitate to send them out to community@solutionreach.com. And then if you are not a customer yet and you have questions about pricing or about different products or features or what it can do for your practice, contact our sales team by emailing them or reaching out via the phone number here. And I'm going to answer one last question we had from Farah. She says, can you send out intake forms like medical history or COVID pre-screening without the questionnaire? As of right now, Farah, the questionnaire would be the ideal method for your patients to fill out pre-screening questions or medical history questions. So that was our very last question we would sneak in today, but thanks
Thank you,
everyone for
Farah.
attending. And that does it for today. We'll see you next week.
All right. Thanks, everybody. Bye.